Hello kids, Teacher Sasa here, and we're back to our health education class. So today, we are going to review the topic that we have last time, and Teacher Sasa will add another lessons in our topic. So our lesson for this week is about medicines and first aid. One more time, medicines and first aid. So what are medicines and what are first aid? The first thing is, medicines are, when taken properly, they help people. When medicines are abused, they harm people instead. So note that this is why some medicines are made up illegal by the law and some can only be used under medical supervision. So, medicines or drugs are substances used to prevent or treat illnesses. So, you can say drugs or medicines, and they help to cure or prevent sickness. So, what do you mean by illegal? Illegal. So, illegal means against the law. Things or acts that are not allowed or not given by the law. Next one is, so there are two categories of drugs. The first one is prescription medicines. One more time, prescription medicines. And the second one, the second type of drugs are called over-the-counter drugs. Over-the-counter drugs or OTG. Okay? So let's know what are the over-the-counter drugs or the prescription drugs. First one is prescription medicines. Prescription medicines. So, these drugs can only be obtained with a doctor's permission. So, when the doctor do not give you permission or give you a receipt that allows you to buy a medicine, you cannot have these drugs. Next one is over-the-counter drugs. So, OTC can be bought anywhere or in a store without a doctor's permission. So those are prescription and over-the-counter drugs. Now let's know what are the importance of medicines. So over here, medicines can prevent people from getting sick, right? When we feel that our body is not feeling good, we will just take medicine and we will feel better. Okay? We will feel better. Okay. Next one is, it will keep us from catching illnesses like measles and chickenpox. Next one. I like that. Next one is, medicines can soothe symptoms and relieve pain. So when we injure ourselves, the doctor will usually prescribe some medicines to help relieve our pain. Okay? Next one. Medicines can help control illnesses, and some of these illnesses are diabetes, asthma, and high blood pressure. And these illnesses do not completely go away. So the drugs that are used are called maintenance medicine. Okay? So we use maintenance medicine for diabetes, asthma, and high blood pressure. Okay, can you repeat these three? Okay, very good. The next one is next one is proper use of medicine. So, how do you use the medicine properly? And do not abuse it. Okay? So, let's know that we have to use medicines in a right way. Proper use of medicines will not only help us quickly, but also will reduce our chances of suffering from side effects. So the first one is read the labels or instruction before consumption. Okay? So when you buy a medicine, don't just drink it right away, or don't just take the pill right away. You have to know what kind of medicine are you drinking or are you taking, or what is it being used for. Okay, next one is keep medicines in a cool and dry place. This one, you can read this on the box of the medicine. Always keep medicines in a cool and dry place so that the chemicals will not be harmed. Next one is keep away from reach of children. Keep away from reach of children. Some medicines have chemicals or substances that are not suitable for children. If the children reach these medicines and accidentally take it, it will cause them harm. Okay? Next one is check the expiry date before taking them. Some of the medicines you do not know when are they going bad. Okay? So some of them have the expiry date. So you have to check it to make sure that you are taking the right medicine, the good medicine. Okay, next one is if the medicine is expired or have gone bad, throw it away. Throw it right away and do not use it. Okay? So after that, we have this thing we call first aid. First aid. So first aid is the assistance or help given to a person who has suffered as a result of an accident. Okay? So when somebody got hurt because of accident or something happened, first aid is needed. So we have to apply first aid when the medical experts are not there to help the patient. Okay? So it can help prevent the person's condition from becoming worse and sometimes even save their lives. Okay? However, first aid should only be attempted by someone who has done a first aid course and knows exactly what to do. Performing first aid without the necessary knowledge might worsen the person's condition or even die. So, we will review and let's see how much you have learned about last week's topic. So, number 1, what is a medicine? What is the answer? A substance that harms people. B, a prescription from the doctor. C, drugs that are made illegal by the law. Or D, substances used to prevent or treat illnesses. Tick tock, tick tock. Letter D. Okay? Next one. Next question is, what are the two types of medicines? What are the two types of medicines? 1, 2, 1, 2. Tick tock, tick tock, tick tock. It's the prescription and over-the-counter drugs or medicines. Number 3. Identify at least 3 illnesses that needs maintenance shown below. So the first one is, what is it? Next one. And the third one is? Answer is diabetes, asthma, and high blood. Number 4. Name the type of medicine shown below. Name the type of medicine shown below. Tick tock, tick tock. Yes, it is called over-the-counter drugs or medicine. Number 5. What do you call the assistance given to a person who has suffered as a result of an accident? What do you call the assistance given to a person who has suffered as a result of an accident? Tick tock, tick tock. Answer is first aid. Okay? First aid. So, let's go and proceed to our next topic. This one is the continuation and it is called misuse of medicine. Misuse of medicine. So, when medicines are taken in the wrong way or in overdose quantities, means too much, they can cause various or serious damage to our health and even death. So, we just have to take the medicine in normal amount or in the correct amount that the doctor is giving us. So, the effects vary depending on the type of medicine, how it was taken, and how much it was taken. So, the types of medicines that we are taking are painkillers. Painkillers. So, these medicines are used to reduce the pain or swelling. Example, this one. We are sick or we have something painful in our body. So, these medicines are called painkillers because they kill pain. Okay, next one is depressants. Depressants. So, depressants is a drug that lowers neurotransmission levels, which is to depress or reduce arousal or stimulation in various areas of the brain. So, example is drugs that are used as sedatives and sleeping pills. Okay, so sleeping pills can help your body sleep, right? Next one is tranquilizers. Tranquilizers. So this drug is used to reduce anxiety, fear, tension, agitation, and related states of mental disturbance. So when you are a nervous person or a person that suffers something mentally, you are given tranquilizers, and they are coming in the form of pills, tablet, or this one needle injection. Next one is Stimulants. Stimulants. So stimulants have the same effect with the tranquilizers. Okay? So these are the drugs that are reduce mental disturbance and give too much energy. Okay? So like this one. So basically, stimulants are drugs that are not allowed by the law. Or these are called the illegal drugs. Okay? And also coffee. But coffee is not a medicine. The caffeine in the coffee is a drug or a substance that is being used in the process of making a stimulant. Okay. So the last one that we have is the CPR. So what is a CPR? CPR stands for cardiopulmonary resuscitation. Cardiopulmonary resuscitation. So resuscitation means taking back. And cardiopulmonary means the heart and the lungs. Okay? So it is an emergency life-saving procedure that is performed when a person's breathing or heartbeat has stopped. So a CPR is a kind of first aid. Okay? It is not a medicine. The next one is chemical exposure. Chemical exposure. So chemicals may cause various damage. We are exposed to chemicals when they come in contact with our skin, our eyes, by ingestion or inhalation. So when we drink or when we breathe something that is harmful or chemicals that are harmful, this will affect our body. So students, boys and girls, this is where Teacher Sasa would stop, and see you on next Friday. Teacher Sasa will discuss this again and talk to you again about this topic. Okay? Bye-bye for now, kids. See you next week.